If you vape or are curious about the effects of vaping, this episode of the Diary of a CEO with Dr. Mike is for you. Today, we delve into the hidden side effects of vaping and the urgent need to stop medical misinformation. Dr. Mike, a practicing physician with over 25 million followers, is on a mission to provide honest, evidence-based health information. In this episode, he unpacks the misconceptions surrounding vaping, its potential dangers, and the broader implications for public health. Here are 5 actionable insights from the episode. Understand the risks. While vaping might be less harmful than smoking traditional cigarettes, it still poses significant health risks, including respiratory and cardiovascular issues. Be informed about these potential dangers. Recognize misinformation. Misinformation about vaping is widespread. Seek information from credible, evidence-based sources and be critical of health claims encountered online. Advocate for transparency. Support and demand transparency in health communications. Knowing the source and backing of medical advice is crucial for making informed decisions. Promote public health measures. Public health advocacy can lead to significant policy changes. Dr. Mike shares his own experience advocating for EpiPens on planes as an example of impactful advocacy. Engage in preventive practices. Prevention is better than cure. Adopt healthy habits like regular exercise, a balanced diet, and mental health practices to reduce the likelihood of turning to vaping or other harmful behaviors. In this episode, Dr. Mike discusses the pervasive issue of medical misinformation, particularly focusing on the hidden side effects of vaping. He emphasizes that while vaping is often perceived as a safer alternative to smoking, it carries its own significant risks. Dr. Mike highlights that vaping can be particularly insidious because it doesn't have the same immediate, noticeable side effects as smoking, such as offensive odors, making it easier for users to conceal their habit and potentially consume higher doses of nicotine more frequently. Dr. Mike points out that many individuals, including some of his close friends who never smoked, have become addicted to vaping. This is particularly concerning among adolescents, whose developing brains are more susceptible to addiction. The chemicals in vaping products, especially nicotine, can alter brain chemistry, leading to long-term dependency and potential mental health issues. The discussion also touches on the lack of comprehensive studies on the long-term effects of vaping, although there have been documented cases of vaping-related lung injuries and even technical malfunctions causing harm. Dr. Mike stresses the importance of viewing vaping not as a harmless alternative, but as a potential health risk, especially for non-smokers who might be tempted to start vaping under the false belief that it is safe. The conversation then broadens to the theme of misinformation in healthcare. Dr. Mike critiques how misinformation spreads and its impact on public health. He underscores the importance of reliable, evidence-based information and the need for critical thinking when evaluating health claims, whether they come from traditional or social media sources. He also reflects on the complexities and ethical considerations of communicating medical advice in a way that is both accurate and accessible to the general public. Dr. Mike addresses the broader implications of health misinformation, drawing parallels with the COVID-19 pandemic. He notes that complacency and misinformation can exacerbate health crises by undermining public trust in medical advice and interventions. He advocates for a balanced approach to health information, where transparency and honesty are paramount, even when it involves acknowledging the limitations and evolving nature of medical knowledge. In conclusion, Dr. Mike's episode is a call to action for better education and awareness around vaping and the broader issue of health misinformation. He encourages listeners to seek out credible sources and to approach health claims with a healthy degree of skepticism, always prioritizing evidence-based practices over quick fixes or unverified remedies.